to use an epinephrine auto injector, sometimes known as an EpiPen. You may have a severe allergy to bee stings, peanuts, shellfish, or certain medicines. If one of these gets into your body, you could have a violent allergic reaction. The signs of a reaction include sudden itching, hives, difficulty breathing, and even a sense that your throat is closing. An autoinjector gives a dose of medicine called epinephrine, and epinephrine can stop the attack. There are several brands of epinephrine auto-injectors. Although they may look different, all of them work in about the same way. This auto-injector comes in a clear plastic case that protects it from damage. It has a window on its side so you can check the medicine from time to time. The medicine should look clear. If it's ever discolored or cloudy, you should throw the injector away and ask your doctor or pharmacist for a new one. You also should keep track of the medicine's expiration date. Be sure to ask for a new auto-injector if yours will expire soon.